I'm Gary, one of the clinical audiologists and part of the ownership team here with Advanced Hearing Group in Arizona. Today we're going to talk about the journey that is treating hearing loss. Yeah, that's right, I said the journey that is treating hearing loss. No, just because you bought hearing aids does not mean that you're successfully treating your hearing loss. It's definitely a large step in the process, but there should be a lot more to it. If you're treating buying hearing aids like buying a widget, you're missing the point. Let me explain the way the journey here in our office goes. First, a patient has to identify a problem. This may be because you or a loved one has pointed out, hey, you're not hearing as well in a restaurant, or you notice, I'm hearing more ringing or buzzing in my ears. Or, wow, I'm turning the TV up a little bit louder than I would have thought I needed to. These are all things that can lead people to believe they're having a hearing loss. But that's just the first step. Once you've identified that you may be having a problem, the next step is to have that problem evaluated by a hearing healthcare provider. In our office, we do all diagnostic testing. We try to rule out any other middle ear pathology that could be contributing to the problem. In other words, when we test your hearing, if you have a mixed hearing loss or a conductive hearing loss, we're going to be referring you out to an ear, nose, and throat surgeon to determine if there's something that can be done surgically or via medication to improve your hearing, not just fitting you with a hearing aid. You see, when you treat hearing aids like a widget or like a computer, and you just go buy one, what's happening is if you didn't have the diagnostic work done, you don't know if that's actually what you need. So now, as a patient, you've identified that you're having a problem. You've gone to see a hearing healthcare provider who has determined that you have the type of hearing loss that would benefit from hearing aids. In other words, there are no medical contraindicators and you don't have any air bone gaps or any major history that need to be evaluated by an ear, nose, and throat surgeon or need medical clearance. So let's say you do have the type of hearing loss that would benefit from hearing aids. The journey doesn't end when your check clears. Just because you bought the hearing aids does not mean that you're done. What we do is we take the time to walk you through the acclimation process. The first time you put the hearing aids on and leave the office, you're not going to be fit at 100%. We're going to give your brain time to acclimate and slowly bring it up in order to give you the benefit that you need and allowing you to wear the hearing aids for more hours a day. The more consistently you utilize the hearing aids, the better you're going to do. Part-time hearing aid wearers never do as well as full-time hearing aid users. The more consistently you wear them, the better you will do. I know that's repeating myself, but it's so important, I'll say it again. The more consistently you use the hearing aids, the better you will do. You may think after you go through the acclimation process, my journey is over. You'd be wrong. Every year to year and a half, even 2 years, you need to have your hearing reevaluated. The hearing aids are set to a specific prescription. That prescription is based off your hearing loss. If you notice that your hearing has gotten worse, you need to be reevaluated and your hearing aids need to be reprogrammed. This is a lifelong journey. The #1 goal for treating hearing loss is to prevent cognitive decline. It's not so you can hear your spouse better or you can hear the TV better. Those are the fortunate side effects, or maybe unfortunate depending on the situation. But the whole goal is to treat the brain, stimulate the brain. Your brain is like a muscle. You need to exercise it and make sure that you're giving it fuel. By treating your sensory deprivations, both vision and hearing, you can help to stave off some of the cognitive decline that occurs with aging. I'm not saying that wearing hearing aids prevents cognitive decline, but it definitely does stimulate the brain and promote positive brain health. Understand, treating your hearing loss is a journey. It's not a one-time purchase and then you're never seen again. I wish it were that simple, but unfortunately that's not the way we work. And that's not the way we work here at Advanced Hearing Group. Our goal is to walk with you hand in hand through your journey of treating your hearing loss. We look forward to seeing you in the clinics, and if you have any questions or comments, please feel free to leave them below. Hear well, live well. This is Gary with Advanced Hearing Group.